Welcome to Summarize Science. Today, we're looking at a fascinating new paper that uses AI to make brain scans for children safer and more reliable. Magnetic resonance imaging, or MRI, is an essential tool for studying brain development in kids. But traditional MRI machines are loud, enclosed spaces, which can be scary for children and often require sedation. A new generation of low-field MRIs offers a solution. They're cheaper, quieter, and more open. However, this comes with a trade-off. The images can have a lower signal-to-noise ratio, leading to visual problems called artifacts. As you can see here, these artifacts can look like noise, motion blur, or strange patterns, which might interfere with a doctor's diagnosis. Checking for these flaws manually is slow and subjective, so researchers are developing AI to automate the process. In this paper, researchers introduce a new system called BRIQA, which stands for Balanced Reweighting and Image Quality Assessment. The first clever thing they discovered is that a one-size-fits-all AI model doesn't work best for this task. As this table shows, different AI architectures are better at spotting different kinds of artifacts. For example, one type of AI might be great at seeing motion blur, while another is an expert at detecting zipper-like patterns. So, BRIQA uses a tailored model for each specific type of artifact, like having a team of specialists instead of one general doctor. The second major challenge is that severe artifacts are rare in the data, meaning the AI doesn't get many examples to learn from. This is a classic class imbalance problem, where the AI might just learn to assume most scans are perfect. To solve this, BRIQA uses a technique called gradient-based reweighting, which dynamically tells the AI to pay extra attention to the rare, flawed images during training. They also developed a custom rotating batching system, visualized here. Instead of randomly feeding data to the AI, this method ensures that every small batch of training data contains a consistent mix of clean scans and scans with artifacts. This forces the AI to constantly practice identifying the problems it needs to find. So, did it work? Absolutely. The system significantly improved the AI's ability to classify artifact severity. The overall accuracy score, called the macro F1 score, jumped from 0.659 to 0.706. This detailed table shows where those improvements came from. BRIQA achieved huge gains in detecting tricky artifacts like noise, zipper patterns, and positioning errors, which are often harder for AIs to learn. So, let's recap the important points. The researchers found that using a diverse team of specialized AIs is more effective than relying on a single one. They also showed that clever data handling, like their rotating batch system, is key to teaching an AI to find rare but critical problems. What does this mean for the future? This work could lead to more reliable, automated quality control for pediatric brain scans, especially for affordable low-field MRI systems. This could improve diagnostic accuracy and make this vital technology more accessible to children everywhere. That's all for this episode of Summarize Science.